Just to start the interview, I'm just going to ask you to spell your first and last name and then give us your title.
Sure. My name is Iza, I-Z-A. Last name is Farino, F is in Frank, E-R-R-I-N-O. And I'm a ICU nurse at Del Seaton Medical Center.
Great. And how long have you been doing that?
It's going to be 4 years in a month.
Great, great. So let's just start, tell us what you love about your job. What made you want to become a nurse?
So I wanted to be a nurse because I love helping people. I think that's always been ingrained in me. And doing nursing, it was definitely my calling. While I was in school, I got a job at the emergency department back in BRAC, and I just fell in love. There's, a lot of teamwork, and there's no better feeling than helping somebody and seeing them through really hard times.
Yeah, and talk about that. We are on some hard times. We've talked about numbers here in Austin, but these numbers are people, and it's nice to finally talk to someone on the front lines who sees this happening. So tell us, what is going on at your hospital? What have you been dealing with since COVID-19 came along?
Yeah, well, we're kind of facing some pretty scary times right now. Yeah, like you said, numbers don't really mean a whole lot, but once you see it face to face, you see how truly terrifying it really is. We've seen young people with no past medical history get extremely sick from this, and it makes you realize that, it's not, it can affect anybody. And that's the scariest part for us too, because we're not, safe from this. We're specially trained to deal with the situations, but even then, we all make mistakes, and it's very scary going in every day thinking, is this the day that I'm gonna get COVID-19? So I think we're all kind of stressed out, and it's scary.
Yeah, and talk about have you been dealing with a lot of COVID patients just personally on a day-to-day basis? Have you been dealing with a lot of these cases?
Yeah, I think I started right from the beginning. I mean, that's all I've seen for the past maybe month and a half. I remember like the first time that I realized I was getting a patient, I was still at home, and I got a phone call asking me what size of a mask I was going to wear for that day. And I realized, okay, it's starting. And I just felt it like my stomach drop. And going into work every day, knowing that that's all I'm going to basically see, it's been kind of hard for all of us.
Yeah, and we know you can't go into any patient details or anything, but was there one patient that you wanted to share their story or, kind of the difficulty of fighting the disease?
So I feel very privileged because I'm able to speak up Spanish, and a large part of our community is Spanish speaking. Sadly, that's kind of the majority of the patients that we're seeing with COVID are Spanish speaking individuals. There was one patient in particular who was about to get intubated. So he's in the room by himself. There's 20 people outside the room getting ready to go in there and intubate him. And he's there scared. He doesn't have anybody around him. The anesthesia group goes in there, full hazmat suits. And luckily I had a walkie-talkie, and I was able to talk him through it and tell him what's going on. And the look in his face when he realized that I spoke Spanish, I'll never forget it. He just lit up, and it just changed everything completely for him. And it was very heartwarming.
Yeah, I think he had a moment where he felt connected and cared for. And that's a big thing right now. We see everybody all in their hazmat and PPE, which is something you have to do. But kind of talk about having, making sure you have that personal connection with your patients.
Yeah, I mean, when we're going into rooms with basically the only thing that they're able to see is our eyes and hear our voice. And that's very hard for us too, because as nurses, we like that personal touch. We like to be able to provide for them emotionally as well. And touch and just seeing a smile is very important for the patients, especially in these situations that are very scary. So I know our nurses have been so good about just like being outside, waving at them so they can see what the face looks like, make that, connection, and just being there for them. Unfortunately, most of the patients that we deal with can't really see us because they're intubated and are under sedation. But when we do have that chance, it's really nice, and I think they really appreciate it too.
Have you had to deal with death, from COVID-19 personally, or just in the ICU?
Um, we've been very fortunate that the majority of our patients have survived, and we've had some successful extubations, which I hear from like the numbers that's very rare. Um, I personally haven't had to deal with it, but I know some of my coworkers have, and that's something that's very difficult for us too, because with the visitor restrictions and families not being able to be there, I mean, it's very difficult on us emotionally seeing somebody die without someone being physically there. So we try to be there for them as well, but we can't replace family. So we're trying to find ways to bridge that gap as well.
And moving forward, what are some of the plans for the hospital handling COVID-19 patients right now?
So I know it's an ever-changing process. Literally every day it's something different. Um, I think right now we're trying to focus, at least for Ascension, try to bring them to the hospital that I'm currently working at, Del Seaton, um, to try to get everybody here to become like experts, and make sure that we know how to handle this situation as well.
And just a couple more questions about just your point of view with things are maybe starting to get geared up, back reopened. Do you feel like you might get another influx, or is this too soon to open businesses maybe?
Yeah, I'm really scared about that. I think we've seen how easily it can spread. So we're definitely very, we're not super happy about it. I think we want people to be safe, and honestly, even with our proper training, we still have to like catch each other because we make mistakes. And someone who's not trained, I don't know how effective it would be for them to like not get COVID out in the community.
Yeah, and do you have like maybe a message to healthcare workers like yourself out there who are all facing this battle right now and fighting it together?
Yeah, I work with some really amazing people, our doctors, our respiratory therapists who don't get mentioned enough for this, even just our housekeeping, our pharmacist. Everyone's been working so hard, and I know they're working hard everywhere else. I always thinking about our fellow nurses in New York, and I feel for them. And um, I really hope that we can get through this, and we're problem solvers. Give us a problem, we'll fix it.
That's what I like to hear. And any more remarks?
No, I think I would want people to be very hyper vigilant when they're out, shopping. Um, be aware of your hands. I think people disregard, or not very aware of what they do with their hands. Um, avoid touching your face. It's such a simple thing, but you do it without thinking. And I think that's probably the riskiest thing about being out in the community.
Yeah, I was doing it the other day. I mean, I probably touch my face so often, just laying on it and stuff. So,
You're doing it right
um,
now.
exactly. You just do it so often. So,
Yes,
um, okay, thank you so much. And you work again at Del Seaton right here downtown
yes,
area.
that's
Okay,
correct.
perfect, perfect. What's your day gonna look like today? Also.
Oh, we've been really busy this morning running around. I mean, it takes so many people to really take care of these patients because once our nurses are in the room, they can be coming in and out. So I've been their hands and eyes outside of the room. So it's busy. It's very, very busy. And this is just the beginning too.
Right. And they talk about peak really hasn't hit in Austin. We've seen UT models. Is that what you're feeling? We're kind of building up to that peak, but we haven't gotten there.
Yeah, I think we're starting to see more and more patients. I think today is the most patients we've had so far. And again, this is they just keep coming. And this is just the critical care unit. We have a lot of patients in our other floors, and they're very sick and they can become very critical at any time. So we definitely have a lot of people here, and we're expecting more.
And I wanted to ask one thing about explain a little bit what intubation and ventilators, what that means, and um, why ventilators are so important too.
Yeah, so one of the main things that they ingrain on us in school is airway is the most important part. If you can't breathe, there's really nothing else you can really do. So airway is always first. So intubation is small tube that goes inside your throat, and basically that is connected to the ventilator. The ventilator is going to provide the oxygen and support for your lungs to be able to function properly. With COVID, we've seen that their lungs are completely filled with fluid, are not able to function properly. So ventilators are essential for these patients to live.
Yeah, and right now your hospital has enough supply. You would say you're not running low or any of
Not
that.
at this moment, no.
That's good. And the intubation process is not very comfortable, right, for you to do or for the patient to deal with.
No, and we've actually set up a process where we have what we called intubation teams, which has been very helpful for us too, and it's been a very helpful tool to kind of keep us all safe. So basically, this team has really specialized gear, and they're very fast at what they do. So that's when I was talking about the hazmat suits. So that's what they wear. And once they go in there, they have to sedate the patient. And it is very scary knowing that, you're going to be asleep and you're not going to really know what's going to happen, if you're going to live or not. So you can kind of imagine how terrifying that could be for the patients and for the workers as well, because it's the riskiest time. Um, the virus can be aerosolized and be that's the highest risk for providers.
Yeah, we just had a healthcare worker in a nursing home. I'm sure you heard about that here in Austin, pass away. So the risk is it's crazy. Is there anything else that we didn't ask that you wanted to say?
No, I think we, as nurses, we really appreciate all the support from the community. We've gotten a lot of, even just coffee or anything has been a really great morale boost. And it's really nice to see that, our work is appreciated.
Yeah, well, we certainly appreciate you as well, and stay healthy for
Thank
sure.
you. You too.
Thanks for your time. Okay,
Bye
bye.
bye.